Coming up on 507, if you find yourself in an emergency situation, here's a question. Would you even know what to do? Seconds could mean the difference between life and death. So tonight, MedStar is offering free training to teach the community how to save lives. Kennedy Walker joins us live from Fort Worth. Kennedy, important information you need to share.
Hey, yes, it is, Keith. And what's better than learning how to save a life? Today, MedStar is offering those free life-saving classes to people. And right now, I'm standing inside of the classrooms. People will be learning how to do CPR, how to administer Narcan, and how to stop excessive bleeding. Now, you can see right now I'm standing in front of some of the dummies right here. This is what's going to be used in those CPR training classes. But again, these are some wonderful life skills that everyone needs to learn how to do. Those classes, they kick off today between 6 and 8 p.m. And again, Keith, this can really just change someone's life. This is something that people deal with, unfortunately, every day, where people are dealing with cardiac arrest or they are dealing with excessive bleeding. So MedStar says that they want to help people learn how to save their lives. So far, more than 100 people already signed up, and more are still welcome to show up tonight. Coming up in the next half hour, we'll be teaching you how to do CPR. Back to you.
Kennedy, I know a lot of people will be tuning in. You're going to check in with us throughout this morning show, and you're going to have multiple examples of how people can learn to save lives. We all need to be paying attention. Kennedy, thank you. It's 5:45. Did you know immediate CPR can actually double or triple chances of survival after cardiac arrests? MedStar tells us they've responded to more than 1,600 cardiac arrest calls in the last year, and only a small percentage of these receive CPR from a bystander. Kennedy Walker joins us live and shows us what to do if you ever encounter someone in need of that type of help. Kennedy, a lot of people are watching. We're all ears.
Hey, good morning, Keith. Yeah, it is very important that everyone knows how to do CPR. Right now, I'm with Matt from MedStar. And Matt, can you just start off by first explaining what CPR is and why you suggest everyone should learn it?
The thing that CPR does is if someone's heart stops, they go into cardiac arrest, there's no blood circulating to the brain and the other vital organs. So bystander CPR will help circulate blood to the brain, to the other vital organs to buy time until EMS can get there and do other interventions.
And what is cardiac arrest? Because I know a lot of people get it confused. They think it's the same thing as a heart attack, but it's actually very different.
Yeah, cardiac arrest is when the heart has actually stopped or it's beating in a way that's not circulating blood. A heart attack is where you have someone who is conscious and there's a blockage in the heart, they're having chest pain. Cardiac arrest victims are unconscious. Heart attack victims are awake and talking.
So let's walk everyone through it. You know, let's do the scenario. You're walking down the street, someone just collapsed. What do you do?
Sure. First thing is you're going to establish the fact that they are actually unresponsive. Hey, 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 can you hear me? Wake up. You really want to yell at them. If they don't respond, call out to help, to yell help, so someone will come with you or come to you and help you. You want to check and see if they're breathing and just listen very briefly to see if they're breathing. If not, call 911. First thing you want to do after you do that, call 911, tell them I've got someone who is unresponsive, not breathing. That way EMS is coming and they can actually help you walk you through this process. Once you've done that, you're basically going to find the center of the victim's chest, take the heel of one hand, put it right on the center of the chest. That's the breastbone or the sternum. It's actually cartilage, so it can be moved. Take your other hand, put it on top of the hand that's on the center of the chest, and you're going to start chest compressions about 120 times per minute, or to the beat of Staying Alive.
Yeah, we were singing that earlier, exactly. and that's a great song to keep in your head.
1, 2, 3, 4, 5, 6,
and
7,
then also,
8, 9,
can you explain
10.
just for swimming? You know, there's a difference between doing this for someone who's swimming and someone who just, you know, had cardiac arrest.
Most of the times when people drown, they actually suffocate. So it's not like they have a lot of water in their lungs typically. So same procedure applies if someone has drowned because, again, their heart has stopped due to lack of oxygen from being under the water. So the same principle applies. Just do chest compressions until EMS arrives.
Great. Thank you so much, Matt. Coming up in the next half hour, we'll be teaching you some more life-saving techniques. We're going to be showing you what to do if you encounter someone that has experiencing excessive bleeding and also needs some Narcan. Back to you, Keith.
All right, Kennedy, that was great. That was interesting. And here's my suggestion. We need to clip that segment off and put it on CBSNewsTexas.com so people who didn't see it live can see it, because people need to know how to do exactly what Matt was explaining just a minute ago. Kennedy, thanks. It's 5:48. 6:07 now. In the last half hour, we showed you how to do CPR, and now we need to show you what to do if you encounter someone who's having major bleeding, like from a shooting. This year, more than 18,000 people have died from gun violence, according to the Gun Violence Archive. In the wake of mass shootings, medical professionals, they want to teach people, many of you, what to do in these threatening situations. Kennedy Walker is live with more.
Hey, Keith. Yeah, if you come to tonight's free training class where you were able to learn a bunch of life-saving techniques here at MedStar in Fort Worth, you'll be able to not only learn how to do CPR as we taught you in the last half hour, but you'll also learn how to stop, some excessive bleeding. This morning, I am back with Matt from MedStar. Please tell us, what we have here, what people are looking at, and what to do if we ever encounter someone who's bleeding excessively. Unfortunately, in this climate with mass shootings happening often, I think it's something that everyone needs to learn how to do.
Absolutely. So the second part of the class tonight is going to be controlling life-threatening hemorrhage. So it's not only applicable for the things we think about with mass shootings and those kind of things, but car crashes or kitchen accidents. So we're going to be teaching people things like direct pressure. So the number one thing to do to stop severe hemorrhage is to literally just take a rag. Doesn't need to be clean, doesn't need to be perfectly clean, doesn't need to be sterile, and literally just apply direct pressure as hard as you can. That will slow down the bleeding, allow clotting to occur. If that doesn't work and now the blood is soaking through, we're going to teach them how to use tourniquets. Tourniquets can either be commercial, like you see here, or some improvised ones that we'll be teaching the class tonight. But to put on a tourniquet, really, essentially, this one is relatively simple. It's Velcro. You attach it, but the key to a tourniquet is it has to be very, very, very tight, because it has to stop all blood flow. So in your case, we're going to apply this tourniquet with the windlass and keep turning it until the bleeding stops. And obviously the tourniquet needs to be applied at least 2 inches above the bleeding. So this tourniquet would be good for an injury to your lower arm. And you're going to keep turning it until the bleeding stops. Don't worry about using tourniquets. In the past, people said, well, if I put a tourniquet on, that means you're going to lose the extremity. That's not typically true anymore. So we just want people to know all of those different techniques, even including how to pack wounds. That might be a puncture wound, a stabbing, something like that.
Show us how to do that, how to puncture wounds.
So you can't do direct pressure on a puncture wound like this because a lot of the bleeding is coming from inside. So we're going to teach them how to take gauze or anything and just keep packing the wound so that you can get that direct pressure on the inside of the skin, and then use the direct pressure on the outside, which now provides pressure not only to the outside of the wound but to the inside of the wound, because you have packed it with gauze or any clean material.
Thank you so much, Matt. And I think a great nugget of knowledge that you used earlier was that you could really just use anything that you have in your possession, a rag, a towel, anything like that.
Exactly.
So Keith, definitely some great information that everyone should learn how to do in today's society. And also coming up in the next half hour, we'll be teaching you how to administer Narcan, another important tool that everyone should learn how to do. Back to you.
Kennedy, these lessons have been great so far this morning, but that one about Narcan, every parent who's watching should be listening to that, especially with what's happening most recently. Kennedy, thank you. Parents need to stop what they're doing right now. You need to pay attention to this next story. There's been a surge of accidental overdoses. And then you have the crisis involving fentanyl poisonings. In the last year, MedStar crews responded to more than 870 patients suffering a potential overdose or poisoning. Now healthcare officials want to teach you how to administer Narcan, which can reverse the effects. Kennedy Walker, in light of recent happenings, I'm sure parents are taking notes.
Hey, I think they are too, Keith. Like you mentioned, Narcan is one of the most effective ways to treat those overdoses. This morning, I am joined with Matt from MedStar. And Matt, this is something that everyone needs to know how to do to administer this life-saving drug.
Exactly right, Kennedy. And just like CPR, just like bleeding control, this is the third thing that people will learn in the class. And if you find someone who is suspected that you think might have overdosed, they're unconscious or they're unresponsive, many times they're not breathing, Narcan is almost an instant instantaneous reversal of that opioid overdose, such as fentanyl. So it's available over the counter. This is what it looks like, and it looks like this when you buy it. When you find someone who is unresponsive and you think they may have overdosed, you basically just unpackage the Narcan. Just like a little nasal spray that you may use, you're going to inject, or you're going to put the end of the tip into the nose, and you're going to press the red plunger all the way. It's going to deliver 4 milligrams of Narcan into the victim, and usually within about a minute, they're going to begin breathing again, and they'll oftentimes wake up from their overdose. It's a wonder drug for overdoses.
And what's great about this is that this can be found over the counter. I mean, at any grocery store, Walmart, Walgreens, which is wonderful, and it's affordable as well.
It's about $30 last we checked for a 2-dose kit. It's available Walgreens, CBS, anywhere. It's really over-the-counter medication, just like Tylenol or anything else. So we hope that many people will carry it. We hope that many people will put it up on walls with their AEDs, because again, if someone has become unconscious and it's not because of an overdose, administering Narcan isn't going to hurt them. So just use it often, because we're doing 2 to 3 overdose cases per day. And again, bystander intervention with Narcan can save a life.
Great. Thank you so much, Matt and Keith. I know you mentioned that this is something that parents want to know about. Everyone should hear about it, especially as we've been covering, you know, all the frequent overdoses that's been happening, even in those schools, now even school districts. They want their teachers to learn how to administer Narcan. So again, it can be found over the counter. It's very affordable, and just make sure you can come to the class tonight to learn how to administer it. Back to you.
Kennedy, hopefully parents now know how to use it, and they can learn if they don't know at that class, but hopefully they don't need to. That's the key. It's 6:48. Here's the information if you're interested. The MedStar training starts at 6 o'clock tonight at the MedStar office. So you should show up and attend if you want to learn more. Still to come, it's 9:07. And, you know, let's be honest, it's a position you never want to be in, but you know it can happen. Someone around you is massively bleeding, or is suffering from an overdose, or having cardiac arrest. Do you know what to do?
I don't know if I can say that I do. I mean, seconds can mean the difference between life and death. So tonight, MedStar is offering free training to teach the community life-saving skills. Our Kennedy Walker has the details.
Tonight, MedStar will be offering free classes to the community. They will be teaching people how to administer Narcan, how to do CPR, and how to stop excessive bleeding. Today, I am joined with Matt from MedStar. Matt, tell everyone why it's so important to learn this.
All 3 of these interventions that folks will learn tonight are the things that make a true difference in life or death while people are waiting for EMS to arrive. So it's important for citizens to know it, so they can be more than bystanders, they can be citizen responders.
I love that. Okay, so we're going to start off here with teaching people how to do CPR.
Right, so for CPR, you want to make sure the person's unresponsive, shake and shout, make sure that they're not responding. If they are not, call 911 to make sure somebody's coming to help you, and they can help you with instructions as well. And then literally, you're just going to take the center of your hand, put it on the breastbone, right in the center of their chest, the heel of your hand. You're going to put your other hand on top of that first hand, and you're going to press 2 inches on the chest at a rate of about 120 times per minute, or to the song Staying Alive, the beat of the song Staying Alive. Keep doing that until either the patient asks you to stop or you're relieved by someone else.
And I love how you said Staying Alive. Also a good song is Row, Row, Row Your Boat, just in case, because kids should know how to do this as well.
Exactly. That tempo is still the same, and if we walk into a house and we hear somebody calling out row, row, row your boat, we pretty much know what's going on in the next room.
Great. Okay, so let's move on now to excessive bleeding. I mean, definitely something that unfortunately a lot of people are dealing with all of the shootings that we've been seeing, mass shootings. Tell us what this is right here.
Sure. So tonight the students are going to learn how to do bleeding control. So the first and most important thing is what we call direct pressure. So if you have an open wound, it's bleeding heavily, you're literally going to take a clean cloth, doesn't need to be sterile, but just take a clean cloth, place it over the injury site, and press as hard as you can with direct pressure. That will normally stop most bleeding. However, if the bleeding doesn't stop, then we do recommend people using a tourniquet. Now you can use a tourniquet that you can buy like this one, or a belt or a tie, something as long as it's thick. So piano wire, fishing line, things like that wouldn't be a good tourniquet, obviously, but anything that is like a tie or a belt can be used as a tourniquet. Just make sure that when you put it on, it's going to be very tight, and you have to put it on tight enough to stop all of the bleeding that's going to be further away from the heart than the bleeding site. So if you have a forearm injury, tourniquet goes above the elbow. If you have a leg injury, the tourniquet goes up at least 2 inches above the injury site.
Great information that people can learn tonight. And then lastly, Narcan. Wow, I mean, people have been talking about this. This is such a great tool for everyone to have for those overdoses.
It is, and with us responding now to 2 to 3 overdose cases per day, when people overdose on fentanyl or other types of opioids, sometimes they stop breathing. So just like CPR, you need to do something that will reverse that stop breathing. So Narcan available over the counter. It's like $30 at Walgreens or at CVS. Just open up the Narcan kit. The person's unresponsive. You're just going to take the plunger and take the nasal component into the nose, squeeze this red plunger all the way. It'll administer the Narcan, and then often within 1 minute, the person will be awake and breathing and talking, and you saved a life.
Great. Thank you so much, Matt. And tonight's free class, it's between 6 to 8 p.m. here in Fort Worth at MedStar's headquarters. Back to you.
Kennedy, thank you so much. Still to come this morning.